Hello everyone, my name is Dr. Marcia Anderson. I haven't made a video like this since COVID-19, but like many other people in Manitoba, I want to be able to do what I can to support the safety of evacuees and people from the areas most impacted by wildfires. I received a message via the Assembly of Manitoba Chiefs that Chief Monias thought it would be helpful to have a doctor talk about the impacts of wildfire smoke, especially for babies and young children. For those of you who don't know, wildfire smoke is made up of lots of really small, fine particles that can get down into the smallest airway parts of our lungs. It also contains gases like carbon monoxide, nitrous oxides, and volatile organic compounds. When we're breathing in the wildfire smoke, this is some of the worst air quality that we might be exposed to in our lifetimes. It actually makes it harder for the lungs to do their job of getting oxygen into our blood so it can get to the rest of our body. All of the fine particles in the air and these gases also cause irritation and inflammation in all the different parts of our breathing passages, from our nose to our throat into those fine small airways. This irritation and inflammation can cause symptoms like irritated eyes, sore throat, runny nose, cough, shortness of breath, chest pain, even heart palpitations. This also makes us more susceptible to infections like pneumonia, COVID-19, and ear infections, especially in babies and young children. As you know, because of the evacuation order in Cross Lake or Pimicikamak, there are fewer health services available than there are in the centers where evacuees are being supported. Although the evidence isn't clear, there is also some evidence that babies and young children are more likely to have long-term health impacts. This can be because babies and young children, their lungs are still growing and developing, and this may result in long-term impacts like COPD or chronic obstructive pulmonary disease. Fortunately, the sooner you get away from the wildfire smoke or it clears, the sooner those short-term impacts like the higher risk of infections, the sore throats, the runny noses will go away too. Because of this, I urge everyone to follow these evacuation orders as quickly as possible, connect with your leadership like Chief Monias, the other leaders in the community, and the evacuation coordinators to get to safety as soon as possible. Ekose.